Okay, so I think it's our first class. Now let me share the screen and let's begin. Okay. So let me open the book that we have to discuss during this course, and let's discuss the most important things you have to keep in mind during studying the OET exam. First of all,
Yes,
Joel,
I have a question.
mm,
Did we decide on OET or IELTS? I wasn't sure.
I don't know. You told me that you have to prepare for the OET exam. Am I right? Or the IELTS
Uh,
exam?
I wasn't sure which one to do.
You have to be sure.
I can do both. They accept both exams. I was
Mm.
thinking which one to do. I don't know
So, uh,
what do you say?
you are still confused about the exam that you want to apply.
I want to take the easiest one. So
Okay. We cannot say that this exam is easier or harder or something like that. Every international exam, Joel, has its own functions, its own strategies, tips, modules. So you have to be careful. But I suggest, because you applied for the IELTS exam twice and you didn't get the score that you want, I told you before that you have to try the OET exam. But again, I don't know if you have already decided yourself if you want to apply for the IELTS exam or maybe OET.
uh, the
Mm.
thing is, I don't mind. I just want your opinion.
You have to
Uh,
decide, Joel. You have to decide yourself. You have to know the exam that you want to apply for, please. This is really crucial. Keep in mind that the OET exam is completely about medical workplace. I mean,
mm,
the vocab, I'm talking about the vocabularies, are going to be little harder because, again, everything is connected to medical workplace. In the IELTS exam, you have to write two essays, but in the OET exam, you have to write a letter. You don't have to write any essay. In the IELTS exam, we have three long passages, but in the OET exam, we have short passages, not that long passages. Absolutely, there is something different about speaking. In the I'm talking now about speaking. The speaking in the OET exam, everything about this exam is going to be connected to, as I told you, medical workplace. But the IELTS exam is going to be in general. Section 1, you have to talk about yourself, personal questions. You have applied for the IELTS exam twice, so you know that in the speaking module in the IELTS exam, the section 1 is going to be about yourself. We have section 2 and section 3. They are connected to each other. There is that big difference between these two international exams. You have to decide yourself, Joel.
okay. The passing grades for OET, I asked. I should get B in everything except for writing C.
So what do you think?
uh, I don't know. We
Oh,
can try OET. I haven't done it, so
okay. Have you applied for the OET exam before?
no, never.
Okay. Do you want me just to give you the general overview about the OET exam? Maybe we can start practicing listening. Later on, let me say that later on, you can decide. But as I told you that the OET exam is completely about medical and science, about medicine and
Oh,
science.
okay.
Okay. Let me open this book and let me show you the guidance about the OET exam, the general overview, because absolutely you haven't applied for this exam before. I'm going to show you the structure of this exam. Okay, let's go down just to show you the map or the general overview. I'm not going to discuss all the information in this book, but I'm going to discuss the most important information you need just to score a good band concerning this exam. Okay, now let me just try to make zoom in and let's begin. Now, if you want to take a look at this page, you notice that the OET exam is the abbreviation about the Occupational English Test. This test absolutely is about, as I told you, it's about test healthcare. Everything is going to be or is connected to medicine and science. So absolutely, like the IELTS exam, we have listening, we have reading, we have writing, and we have speaking. Every form is different in the OET exam. I mean, the listening module in the IELTS exam, Joel, is completely different from the listening in the OET exam. It is the same of reading, writing, and speaking. Okay?
Okay.
Okay. So now let me try to complete reading just to discuss again the most important things you need to know. So if you notice here, the people who are going to apply for the OET exam are required to write accurate professional letters, not essays like the IELTS exam, with the aid of prompts. Absolutely. The prompts are going to be shown on your screen and you have to write and speak about them. So, as I told you, everything is related to specific healthcare professions because you are a doctor, a nurse, you don't want to visit the world, for example, or to apply to any other job in the future. Okay. Now, the OET exam is about 12 professions. It's about dentistry, now dietetics, medicine, nursing, occupational therapy, optometry. The meaning of optometry is about the ability to see.
Oh,
Yeah, exactly. It's about vision, the ability to
yes.
see clearly, connected to eyes, pharmacy, and physiotherapy, podiatry, and radiography. It's about the pictures that you can take in the laboratories or something like that. And it's the ability to speak clearly or the problems about speaking. And absolutely, it's about animals and taking care of animals. So these are the professions about applying the OET exam. Absolutely, as I told you, everything is connected to medical workplace. So this is the speaking and writing parts of the book. Exactly. So the writing section and the speaking section are connected to nursing and medicine specific test content. So please, we have to be careful because it's not like the IELTS exam at all. Okay. I'm going to, as I told you, show and explain the most important things. Okay. Now, what is the structure, the format of the OET exam? What is the content of this exam? The OET exam is approximately about 2 hours and 45 minutes long. This exam consists of 42 listening questions, 42 reading questions, 2 speaking role plays, and 1 writing task. The 1 writing task is going to be about writing a letter. So it's not like the IELTS exam, because the academic IELTS exam, when you applied to this exam, you notice that you have to write 2 essays. It's not like this. You have to write a letter, but not an essay. So this is it. This is the map or the format about the OET exam. And listening, you have 40 minutes just to cover this exam, and you have to listen and understand to a range of recordings on a healthcare topics, absolutely, from different healthcare settings. The reading, you have to spend 1 hour just to solve 42 questions. Absolutely, you have to read and understand various texts on healthcare topics from different healthcare settings. This is about writing. You have to spend 45 minutes to write. And as I told you, you have to write a letter. This letter is usually about a referral letter using information provided in patient case notes. It's about sick people, it's about patients. So this is the letter that you have to write about. Now, the speaker module or exam, it's going to be about 20 minutes. You have to communicate. You have to talk to patients. Absolutely, the speaking exam is going to be about a real life context through the use of role plays. I'm talking about doctors, the conversation between doctors, maybe pharmacists, and absolutely patients or sick people. Or I have to say that nurses again. Okay, so this is it. This is the structure of the OET exam, and this is the scoring. Now, if you want to ask me about the way the OET exam is scored, we notice that if you want to get the band between 450 to 50 or 500, sorry, it is like getting 8 band to 9 band in the IELTS exam. And if you want to scroll down just to check this band, if you want to get the band from 350 to 440, it's like you get 7.5, 7 to 7.5 in the IELTS exam. I am sure, Joel, that the university that you are applying for, I think they asked you about the band that you have to achieve in the OET exam.
Yes,
Now,
they want B in everything and C for writing.
C for writing. It's writing a letter. I don't think that writing a letter is that hard, Joel. But absolutely, you have to have enough medical vocabulary just to be able to write the letter. Okay?
Yes, of course.
By the way, I have a book. This book consists of the most useful and common vocabulary you need for the OET exam, because absolutely you have to speak clearly, completely, and you have to write a good letter. You have to have, as I told you, enough vocab. If you don't have vocab, you cannot speak clearly. You don't know how to speak or how to deliver the good idea or the complete idea, and absolutely you will not be able to write a complete letter concerning this field. And even reading, because if you want to read, I'm not talking about only Joel, writing or speaking. In listening, if you want to listen, you have to understand the symptoms, the diagnosis, for example, because you have to fill the blanks, you have to fill the gaps. I mean, you have to select the correct multiple choice. So this is extremely important. Okay, so this is the score concerning the OET exam. If you want me to compare it to the IELTS exam, this is exactly the score, and this is what you have to know about OET, which is compared to IELTS exam. Okay. Now, not only in the OET exam, Joel, even in the IELTS exam, you notice that timing is extremely important. Let me tell you something. I don't know if this thing really happened to you. 70% of my students who are applying, or let me say who applied in the past, to the IELTS exam, they said that, teacher, the 1 hour, I'm talking about reading now, the 1 hour is finished without being able to fully answer the questions. It's because the time was really up without having that enough time to solve all the questions concerning reading. This is extremely important. You have to know how to divide your time. You have to learn how to time yourself, because time is extremely important. Because as I told you, some students, if now I'm talking about the IELTS exam, solve let me say that 20 questions in reading section in the IELTS exam correctly, yes, but they don't have time just to complete because time was finished and because they didn't specify or divide the time correctly. If you notice that in the IELTS exam, the ideal way just to divide your time, now I'm talking about reading, because reading in the IELTS exam, you have to spend 1 hour in reading. You have to specify or divide the time every section, because we have 3 sections in the IELTS exam, 20 minutes for every section. If you want to do this way, absolutely, you will complete the 1 hour answering all the questions. And there is something really important in timing. Now, I'm talking about both exams, Joel. Now, I'm trying to compare both exams just to help you to decide yourself, because I noticed that you haven't decided yet the exam that you want to apply for. In the IELTS exam, you have to, in section 1, you have to spend 20 minutes, try to spend 20 minutes to solve this exam. Maybe you take 25 minutes, not 20. This is really okay, because maybe you will finish answering section 2 in 15 minutes only. So this is something normal, just to take a few minutes for every section. But try to be aware, because you have only 1 hour to finish answering all the questions in the IELTS exam. And I don't know if this really happened to you, because maybe the 1 hour has finished without completing answering all the questions. So please, time is really important. You have to divide your time just to be able to answer all the questions. And absolutely, we have to specify the time here while practicing. Okay. In the listening test, Joel, you will not need, or you don't have to divide your time, because you will notice that while answering or solving or filling the gaps, or maybe choosing the correct multiple choice. So as you will be advised when answering the questions, because you have to listen and answer at the same time. But absolutely, you have to be careful, because time is really important, not only in speaking, but also with the 4 skills. Okay. Let me check the most important information I have to tell you. Remember, not able to complete. Okay. There is something you have to know, Joel, concerning both exams. Remember that even if you are not able to complete the whole section within the time limit, you have to, or you should still include the answer, even if the answer is just a guess. Some students, Joel, because they don't know the exact answer, they leave the answer blank. Please don't do so. You have to write something. Even if this thing is a guess, write it down. You don't have to leave any question blank. So please write any answer. Maybe you are not sure about a certain answer. Write your guess. Maybe this guessing is going to be correct, because write a guess. It's better than leaving the answer blank. So you may choose the correct answer by chance, and maybe you will gain additional point. So please don't leave anything blank. I'm talking about any international exam. It's not only for the OET exam. Okay. And there's something you have to know while answering the questions. Maybe you will spend more time on a certain task. When you are moving too slow and practice speaking, or maybe writing or answering any question, you have to be faster in the rest of the questions, please, because as I told you, time is really important. If you don't know how to divide your time, this is something bad, because you will not be able to answer all the questions. And this is really happened to 50% of students who are applying to these exams. Okay. Let me scroll down just to check the most important thing. Okay. Um, Let me just scroll down. This is you have to do it yourself. General strategies. We have to discuss this during the practice and tips for the final week, the day before the test day. Okay, after that, before the test, that is, we don't have to lose our time discussing these things. Okay, now during the exam, the OET exam, Joel, requires a high level of concentration and a quick responses. I know that you have applied for the IELTS exam, and you notice that you have to be as fast as you can. You don't have your own time just to solve everything, because you notice that everything is timed. So you have to, or your state of mind as you take the test will affect your score. Let me tell you something, Joel, which is really important. Some students, for example, while answering part one in the IELTS exam, because they are confused or maybe shy, they don't do great or good on section one. This is something I consider this thing is little normal or okay, because you have a second chance to compensate the lost marks, for example, in section 2 and section 3. So don't think if you don't do good in a certain part, this is something bad. Because if you want to feel angry, Joel, or if you want to be upset, you will not be able to complete your exam in a good way. So please don't make part one or part two, for example, or part three affect your score is just because you didn't or you don't answer correctly. This is something I don't want to say that this is something okay, but you have to be positive and you have to concentrate on the next parts, because not all the exam is about part one or part two. So please, this is really important. So this is why you have to keep moving. So keep moving if you find yourself stuck during OET. Don't spend too much time trying to focus on the question that you don't know. Try to move on. When you finish and still have enough time, you can go back to that question. So whether you are struggling to understand, for example, what the speaker is saying in the listening test, try to find meaning in a difficult paragraph in the reading test, for example, or trying to remember the correct word or phrase to use in the speaking or writing test. Okay. Remind yourself that it is okay to make some mistakes. You are not a professional, and at the end of the road, Joel, we are not native speakers. Even the native speakers, they do some mistakes. If you want to watch some YouTube videos about some students who are living in USA, for example, or UK, although that they are native speakers, I mean, the English language is their first language, still they do commit some mistakes. So committing mistakes is something normal. These kinds of exams, Joel, is not to get the full mark or something like that, because these exams just to check your proficiency in the English language, like overall. So committing mistakes is something normal. Please try to keep moving, because you have to concentrate on the next parts. So you don't have to get everything right to achieve good score. So don't spend an excessive amount of time on a question, because this will affect the next questions. You will not have enough time to answer the next questions. So this is really bad. Or maybe in speaking and in writing, maybe you are stuck in trying to remember a certain vocab or phrase to use to speak or write. So try to use all the time, Joel. Try to use synonyms, try to use antonyms, try to use definitions, and try to use examples all the time if you are stuck. We are going to discuss that into details, but try to do this way. Let me give you an example. Maybe now let's imagine that now you are in the speaking exam. You want to talk about insomnia. Do you know the meaning of insomnia?
Yes, it's when we can't sleep.
Bravo. So notice what did you say? The inability to sleep. Am I right?
Yes.
Okay. Some students, Joel, they don't know the meaning or the exact meaning of insomnia, or maybe they don't know how to say it. If you don't know the exact meaning or exact vocab in writing and speaking, try to use synonyms, antonyms, definitions, or examples. Now, if you want to say, for example, the inability to sleep, so notice that the inability to sleep is a kind of definition of insomnia, and it is totally correct. So don't think that all the time you have to say or write the exact vocab. If you are stuck in a certain vocab, try to find synonyms, for example. Try to find antonyms, the opposite meanings. Try to give some examples about the word that you don't know. Try to define the unknown word, like the inability to sleep. Because if you want to say, Joel, the inability to sleep, or maybe write this definition, it is completely correct. So, but don't stop, because again, you are losing your time. Okay. So let me scroll down. I don't want to lose all the time trying to explain something which is not important. Absolutely, you have to be positive in answering the OET exam. Okay, so this is, let me say that the general overview about the OET exam, the background about this exam.